Bénédicte.
Yes, so here we are at St Thomas's. You'll remember that the British Prime Minister Boris Johnson was here several months ago and he became very, very ill. He ended up in intensive care unit, and that was with Covid-19. There is some speculation that he may have had a jab, so we're going to watch out and to find out about that. But Margaret Keenan, the 19-year-old grandmother, says she feels privileged. It's the best early birthday present that she could have had. And she, like many thousands and indeed across the world, millions of people, has now that hope that she can now will see in a few weeks' time her friends and her family. So many people have been isolated and had to confine themselves because of whether it's government measures, and of course we've had lockdowns, we've had confinements, and there are still very strict measures. We're here in Tier 2 here in London, in the British capital. The second person who has had a jab, I understand, is a man called William Shakespeare. So I give that to you. So the hope is that really this jab is going to turn around the tide in the battle against coronavirus. 61,500 people have already died here in the UK from COVID-19. So there is huge hope. And the way it's administered is that you get 2 jabs. So Margaret Keenan will in 3 weeks' time get her second dose. There are 800,000 vaccines that have already been transported, this Pfizer BioNTech German-American jab that has come over, made in Belgium, made it through the Eurotunnel, interestingly transported in unmarked vans very secretly, and the logistics are very complex. It's the biggest mass vaccination program that the UK has ever undertaken. I am here in the British capital in London in England, but the 3 other nations are also have begun vaccinating people, so in Northern Ireland, in Scotland and in Wales today. What is important to underline is we don't yet know whether it protects the person themselves, but we don't know if you can still transmit the virus. So it is really important that people, says Matt Hancock, the Health Secretary, respect social distancing, wearing face coverings, masks, and wash their hands frequently. So yes, welcome to what is V-Day, Vaccine Day here in the UK.
It does sound encouraging, Bénédicte, and it does come as things there in the UK are actually getting worse when it comes to COVID. Tell us about that.
Yes, the number of infections across the United Kingdom is about 15,000 a day. Now, we have had higher, and what was noticeable is that when people were absolutely yearning to go on holiday, we had that peak again. So we've had, over the last 2 to 3 months, that introduction of that tier system with very strict measures, and I was alluding it to. Of course, back in the spring, we had the total lockdown. And of course, beyond the health damage and the grievance, people grieving across the country as they are across the world, that incredible economic damage that we already know about. Restaurants, the hospitality industry, the aviation industry, all of that. And of course, here in the United Kingdom, there is this, are we going to get a Brexit deal or no Brexit deal? And the link with the COVID-19 vaccine is interesting because, of course, contingency planning, as we don't know if there's going to be a deal or not, that is in the hands of the Prime Minister and of 27 EU leaders, and we perhaps will know that in the next 48 hours, whether that can be done or not. The contingency planning is that it's been decided that if it's necessary, then there will be the RAF, the British military, that will actually airlift the COVID vaccine and this new Pfizer BioNTech vaccine to the United Kingdom. So, as I said, a huge rollout, but really the millions that we'll have, just 4 million before Christmas, will be actually in the new year. And then the Health Secretary I was just listening to moments ago, Matt Hancock, saying that on the back end of spring, he has great hopes for summer 2021, that life will begin very much by then to be back to normal.
Bénédicte, thanks for that. Let's hope that is indeed what happens. Bénédicte Paviot there reporting for us from London.